Bismillahirrahmanirrahim. Assalamu alaikum, doctors. Myself, Mohammad Asim Hussain, working as product manager in Genix Pharmaceuticals. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in the year 2004. We have vision to help and provide top quality and affordable medicine for all those in need. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improving the lives of people associated with us at all level because we are dedicated to good health. Today our session is a part of educational and activity and presentation topic is very unique attention deficit hyperactivity disorder presented by a well-known legendary consultant Professor Dr. Arif Herekar. He is consultant neurologist. He is MD neurology, masters in child neurology, University of Rome. He is chairman Headache Research Foundation of Pakistan, chairman Department of Neurology, Baqai Medical University. He is also visiting faculty in Dawn University of Health Sciences. He is professionally very busy person, but always available for education. Thank you so much for sir to join us. Dear doctors, if there is any question or query, please drop your question in question answer box. Question answer session will be after presentation. Over to you, sir. Thank you, sir.
Thank you very much. Bismillahirrahmanirrahim. ADHD basically is not a very simple disease. It occurs right when the mother is pregnant. So these diseases are difficult to treat, but then we need to address them in the nick of time. So the question is, what is ADHD? Now, all the young doctors who are listening to me should pay very special attention to this, because in the last 1 year, I've had at least 500 patients. And the prevalence somehow, or the presence of ADHD is continuing to mount, continuing to grow in the last couple of years. And we really have to address this issue. It is not a simple issue to address. So please keep your eyes and ears open. ADHD stands for attention deficit hyperactive disorder. It is a medical condition, of course. A person with ADHD has differences in brain development, like I've told you, and brain activity that affects attention, the ability to sit still, and loss of self-control. These are very, very important, and these are very, very difficult at times to control. So ADHD can affect a child at school, at home, and in friendships. So what is the prevalence of ADHD in Pakistan? Actually, we have here a status of ADHD in Pakistan, the prevalence, which is 2.49%. I don't know how old this is, but this is because, you see, it is never easy to do large studies in any Southeast Asian country. But this will be taken as standard, 2.49%. And of course, it is always seen that boys of ADHD outnumber girls. But the ratio varies significantly from 2 to 1. So the gender differences are less obvious for inattentive ADHD. Now, one of the types of ADHD has inattention. The child does not attend to a call or to a response. Boys are more likely to be aggressive and to have other behavioral problems. So whenever we encounter these patients, boys are more difficult to treat because they are more aggressive. So when you come to the ADHD domains, there are 3 major types: the inattentive type of kid, the hyperactive kid, and of course, the impulsive kid. So kids are inattentive and they have trouble in focusing. Obviously, when the child is inattentive, there'll be a difficulty in focusing, difficulty in concentrating, and of course, staying on the task. Obviously, when you don't concentrate, you cannot do any sort of task. They may not listen well to directions. They may miss important dawdles and may not finish whatever they start with. So they are poor scholastically. Scholastic means schooling. They may daydream or dawdle too much. So what they do is they are restless. They may seem absent-minded or forgetful. And of course, when all this is happening to a child, they lose track of their things. So then we come to the hyperactive child. Now, what is a hyperactive child? These kids are, of course, hyperactive. Fidgety means bechan, restless and easily bored. So these children are not really focusing themselves. They are not part of a gathering. So obviously all these things, fidgetiness, restlessness and boredom, they will take them away from a normal social life. They may have trouble sitting still or staying quiet when needed. So when you look at this child, he is always restless. They may rush through things and make careless mistakes. They may climb, jump or roughhouse when they shouldn't. Without meaning to do that, they may act in ways that disturb others. The third type is the impulsive disorder. Kids who are impulsive act too quickly before thinking. They often interrupt, bite, grab, and find it hard to wait. They may do things without asking for permission, and so they're very impulsive. They won't wait for you, and they take things that aren't theirs or act in ways that are risky. They may have emotional reactions that seem to be intense in the situation. So all these things are going to create a very disturbed child. So like I've already told you, there are three major types of ADHD. One that combines two things together. The most common one is one that is a combined sort of ADHD, which is characterized by both impulsiveness and hyperactive behavior, as well as inattention and distractibility. So it has four elements. The number two is impulsive and hyperactive. And this is without inattention and distractibility. So this is a little more easier to treat. Then you come to the one which is only has inattention and distractibility. So these are the three major types that you have. So coming to these next, the hyperactive and impulsive form, the same age and time-based criteria as above are necessary for an ADHD diagnosis. So you have to have all these elements: fidgetiness, ignores instruction, moves about or feels restless, cannot participate in leisurely activities. What I mean to say is antisocial, excessive talking. He keeps on talking and bursts out answers before a question is finished. Trouble waiting for their turn, and of course one that interrupts conversation. And then we come to the inattentive type. Now for children up to 16 years old, 6 or more symptoms of inattention must be present. We are talking of children 16 years, up to 16 years, and then we are talking of adults who are 17 and above. So what happens is, of course, you have ADHD in adults as well. So these symptoms may be present for at least 6 months to suggest a diagnosis of ADHD. Often, so what happens? What are the criteria? What are the elements that are important? They often make careless mistakes. They have difficulty staying attuned to specific tasks. They do not listen when they're spoken to. This is very important. And what I'm saying is, all those who are online with us, please pay attention. This is a very difficult subject, and I've been dealing with it for the last 40 years, 4 decades. They have difficulty in organizing. They avoid likes and dislikes, often loses track of important things. So they are forgetful, they're distractful, and of course, they have multiple problems. It is possible to diagnose an adult with ADHD. Now we are talking now of adults. And this disorder is diagnosed when the child also has ADHD but goes undiagnosed. So in the adult, there are conditions where they're late and forgetful. They suffer from anxiety. They have low esteem, trouble coping with work. They struggle with employment. They have poor organizational skills. They have difficulty in completing tasks. Of course, they are irritable and have a short temper. And they are, of course, their impulsive behavior is difficult to control. So functional consequences of ADHD. So what happens? So when a child has ADHD, what is going to happen to the child? There will be no school performance. There will be poor occupational performance. Of course, a child who has this can go onto the road and have traffic accidents. They can violate things. And of course, employment will be very difficult. Obviously, who's going to employ someone who has an ADHD? So all these things put together, what are the causes? I've told you the cause is basically when the mother is pregnant, when the child is a fetus. He has brain injury, he's exposed to environmentalists. When the mother is child in the as a fetus, alcohol, tobacco use in pregnancy, premature delivery, and of course, low birth weight. All these together can create an ADHD child. And when you have ADHD with psychiatric comorbidities, it becomes even more difficult. Some of these patients who have ADHD will have sleep disorders, they will be impulsive, they will have anxiety disorders, they will have intellectual disability, of course, mood disorders, syndromes, and of course, autism. So all these things put together, when you have the comorbidities, it's even more difficult. So when do you actually diagnose these patients? Either a teacher is going to diagnose them, or they will be diagnosed. Their own habitat or their own activity or behavior will create the diagnosis, or of course the parents will realize it. So all happening, what is the therapeutic option? Can we do anything for a child with ADHD? Yes, we can. At least in a way, we can do it. So there are two different types or classes of drugs. One is stimulant drugs, which are, number one is methylphenidate. I've been using that for 30 years. Amphetamine, these are stimulants. And then you go to the recent most, the non-stimulant drugs, which are obviously much more safer than the stimulant drugs. And atomoxetine. Atomoxetine is a very good drug. And of course, you also have in the market clonidine. So now the question is, what actually happens? We have talked about this. We have talked about the symptomatology of ADHD. But what is the basic pathophysiology? Are we also dealing with neurotransmitters? Of course. Everything that happens in the human brain is related to one or the other neurotransmitter. So when we talk of noradrenaline as a neurotransmitter in the central nervous system, norepinephrine increases alertness. So if you have a decrease in norepinephrine or noradrenaline, you have problem with alertness and arousal and speed reaction. The other thing that can happen in patients who have low levels of norepinephrine is person's mood and ability to concentrate. So imagine how important this neurotransmitter noradrenaline is. It has multiple deficits. It can, if it's low in and hypotension. Then we come to the other neurotransmitter, dopamine. You must have heard of dopamine from the Parkinson's disease thing. The dopamine levels are very important. These neurotransmitters are monoamines. So dopamine levels can affect a person's mood, number one, attention, number two, motivation, number three, and movement. So dopamine deficiency can also augment or compound problems that are occurring because of low noradrenaline level. So dopamine also regulates the brain's reward system and increase the brain's, when the levels increase, when a person experiences. So what really happens is their pleasurability, eating food, doing things, and these things are very important. And this is controlled also partly by dopamine. So what are the roles of dopamine in ADHD? Now, does it have any role to play in ADHD? Raising levels of this neurotransmitter, dopamine in the frontal cortex of the brain significantly decreases impulsiveness in healthy adults in a study conducted by researchers. So impulsivity is a risk factor for addiction to many substances. And it has been suggested that people with lower levels of this neurotransmitter dopamine in the frontal cortex tend to be more impulsive. This was investigated and has been proved as well. So we come to the drug which is called atomoxetine. Now, what does atomoxetine actually do? One of its chemicals in the brain called noradrenaline, this neurotransmitter is released, and when there is an uptake of noradrenaline, this is where atomoxetine acts. After sending the signal, norepinephrine is taken back by the nerve ending. Obviously, there is always a recycling going on. So what does atomoxetine do? This is a molecule that stops this process and increases the levels of norepinephrine. I've already told you that there are very, very important things that happen in the human brain with norepinephrine. So when you have high levels of this in the brain, you're more alert and ready for action. It should help to increase your attention span and, of course, your concentration and your thinking. So coming to the neurobiology of ADHD, there are three major areas that are involved. The dorsolateral, now we are focusing everything that is happening. The dysregulation is happening in the prefrontal cortex. Remember one thing, PFC stands for prefrontal cortex. आप लोग बड़ा important है कोई आपसे पूछे कि where do these problems lie in ADHD? Not only ADHD, or all mental retardation, frontal cortex is very, very important. So three locations: the dorsolateral prefrontal cortex, the ventromedial prefrontal cortex, and of course the right inferior prefrontal cortex. They are all involved, and they can cause impairment, inappropriate emotional responses. They can cause impulsivity, hyperactivity, and of course inattention and distraction. So what is the scientific cause of ADHD? The prefrontal cortex, as I've already told you, is out of tune. It's not up to date. ADHD pyramidal neurons in the prefrontal cortex are hypothetically out of tune. Specific functioning in the brain area with the prefrontal cortex theoretically mediates the various symptoms of ADHD. So you can see on the screen the mechanism of action. I'm not going to go into details. This is very basic, but what is happening here is that you can see the levels of dopamine are being controlled by stopping the reuptake of this substance, and atomoxetine is exactly doing that. It has a mode of action that increases these neurotransmitters and helps in controlling agitation, controlling restlessness. So atomoxetine is well absorbed. We have been giving it, I've been using it on a huge chunk of patients. It has a half-life of 6 hours, and the plasma levels are, of course, reached in 2 to 3 hours. Obviously, like every other disease, remember one thing, कोई ऐसी दुनिया में treatment नहीं है जिसके मोज़र असरात ना हो, adversities. So every drug has side effects. So does all these drugs. When we are talking atomoxetine, it has all these things that you see there, and these are very, very mild. Drugs can have very, very intense and fulminating side effects, but this one has mild side effects. But the amount of action and the improvement that can cause in agitation is, of course, very, very important. So this is the dose chart, and the dose chart I leave it to the company to answer these questions. And remember, drug-to-drug interaction. Of course, you can always talk to our people in the company. Of course, MAO inhibitors, including isocarboxyl, linezolid, methyl blue injection, and all these. You have to be very, very careful when you're treating this patient. Of course, you must remember that patients with severe heart or blood vessel problem and narrow angle glaucoma, you have to look at this. So there has been studies, there have been huge amount of studies. This study is a once daily administration of atomoxetine is an effective treatment for children and adolescents both with ADHD. I hope you have understood this. If you have any questions, I'm always there to answer them. Thank you.
Thank you so much, sir. Wonderful presentation, and I enjoyed really, and I hope most of our participants enjoyed this session. Sir, we have some questions. Doctor asked that what is the duration of treatment of atomoxetine?
Yes, it's a very, very good question. I mean, the question is that now I have already started on this note, and I've told you that attention deficit hyperactive disorder is a difficult condition to treat. There are no streamlining periods of administration. You have to keep going with these medications for years together. Obviously, the adversities are much less, so it might take a couple of years to control these symptoms. Once the child is growing up, you know that when a patient with ADHD goes into adulthood, he's more composed. So one needs to give them over a long period of time, of course.
Next question we have, there is any known pharmacological suggestions for ADHD treatment?
Yes, of course, people have been using therapy, various types of therapies for ADHD. But of course, controlling symptoms of ADHDs without enhancing the levels of neurotransmitters. Now, the levels of neurotransmitters cannot be improved with therapies, but obviously additional add-on therapies will definitely help.
Is there any role of ECT and benzodiazepine in ADHD?
Not really, not really. I don't think there's any role actually, because benzodiazepines are not, remember, a benzodiazepine is an anxiolytic. What is an anxiolytic? An anxiolytic is one that controls anxiety alone. So ADHD is just not anxiety alone. It has multiple factors. It has multiple symptomatology. So giving a patient an anxiolytic alone does not suffice. You must add more important specific medications.
Thank you so much, sir. Wonderful presentation and questions and answer session. Thank you so much, sir, for your time.
Thank you.
Thank you.